Previously to the Stay UA program, the crews would go out on an emergency run or see a resident that needed assistance, and they would try to do the best they can. But since we're responding to 911 calls in emergency situations, they had to be in service and couldn't stay there and help out for an extended period of time. So they would also contact the EMS and training office, and we would try to go out and make those contacts and assist where possible. A lot of times our resources ended up being Adult Protective Services, which is a very aggressive way to handle some of the situations that we run into, some of the minor situations. So by having a service coordinator, we've been able to basically bring it down to, I want to call, a more humane level, where we are getting in there and we're becoming friends with them, letting them know we care. And we've always cared about our residents, but really letting them feel that and make that known. The crews go out on emergency 911 calls, and they find residents that need assistance, that they're unable to help, and maybe those residents don't need to be transported or don't want to be transported to an emergency department. So the crews will either contact our service coordinator or myself, and we'll go out and visit them, and the service coordinator is the main contact. Sometimes the service coordinator on the first contact will go out and just get oriented or welcomed by that person, or may even get turned away and needs to be a little more persistent and get back to the resident at a later date. From there, when the service coordinator makes contact with the resident in a positive way, she'll sit down, she may have a cup of coffee with them, get to know the issues at hand, and then is able to provide services or suggest services to the resident. We didn't have the social work knowledge and background, so we were excited to be able to get somebody in to assist us with that and assist the community. So once the service coordinator sits down and starts building a relationship with the resident, they sit down and they communicate together and decide on what services are needed for the resident, and then come up with the community services available to the resident that the resident may choose to select. From there, the service coordinator will at a later date call back and check up to make sure those services are in place and working properly for the resident, because that's who we are ultimately, that is our ultimate goal, is to have those services in place and have that resident stay in Upper Arlington for as long as possible safely and remain safely in their home. I think it shows that the city cares about them. Nowadays, with the economy, and taxes, everybody wants to increase taxes and things. We have been able to bring a program to the community, to its residents, and help them and let them know that we care as a fire division, as a city, and I think it brings the community closer together.
I have been here for over the last year and have met Jamie, who is our service coordinator for Fire and Seniors Together here in Ross County. It actually just serves, of course, just Chillicothe. And she and I have been working very closely together. The program is phenomenal for the seniors here in the area. They're able to count on someone that they can call to help them figure some things out, or just different services that they need. Jamie is the perfect person for this job. She is amazing. She is able to go into an environment where, of course, our elderly are very protective of themselves and their homes, and able to befriend them and then offer them services that most of them really desperately need. The program is wonderful, and Jamie is too. She has always come over anytime one of our social workers will call her with a discharge, because we're also a therapy rehab unit. We also have skilled nursing. But she'll come over and meet with these individuals once the social worker calls her and they're getting ready to be discharged. So she'll go in and meet with them and talk to them about the program, what she's able to help them do, and if they have any non-911 emergencies, that this is who they should call. And it really is beneficial because they get to meet her before they actually need her. And I just can't say enough nice things about the program or Jamie. It's really something vital for our community.
When they first talked to us about putting a social services coordinator in the fire station, we really didn't quite understand what it would lead up to or how it would work. But Jamie's been very proactive. She's basically created a program where no program existed. So it's been a It's been a learning experience for all of us. Jamie came and established the program. We basically would go to the person's home, give them the medical care they needed, and transport them to the hospital. There was really no follow-up. We had no way to follow up with them. We had really no way to take care of their needs other than their emergency medical needs. It's really rewarding, and it makes you feel like you're doing actually more than just a trip to the hospital.
I'm so fortunate, and Sharon and I both are, that we have a company that backs the position, hoping that the 911 non-emergency calls will be reduced, which is a cost savings to the city. It's hard to say. I know the chief that I work with talks a lot about how what I do is kind of like fire prevention. You don't know how many fires you're putting out, and what we deal with every day are different type of fires. So it's hard to put a number on that. It's hard to put a figure on what are we saving the community. We can sometimes put a figure on how we're saving the resident.
What were your feelings before Jamie came around? What had you been led to
I was in the
believe?
pit. I was in the pit.
You were in the pits, and that was
I couldn't
because
get no help. I needed help and couldn't get anything. My health is going down the hill. It just wasn't nothing. Nobody cared. Nobody tried to give me help. It just wasn't out there.
So what would you say now? Not only has she been able to get some things done for you and get some action going, do you look forward to her visiting? Do you ever
Yes.
feel like she's an interference in your
No,
life or an
no,
invasion of your
no,
privacy?
No.
Okay. I
She
understand that.
feels like a little sister.
Oh, that's wonderful. We all like to hear that. Positive
Yes.
thing in
Very
your life.
Yes.
Did she take away that kind of hopeless feeling?
Yes, she did.
Were you
She still does.
apprehensive when you first met Jamie about letting a stranger into your life? Let me ask that.
No, not when the fire department came. She told me who she was with, and I was glad to see her.
Okay. So if it probably had been anybody else, you may have felt a little...
Yes.
You think she's helped you with the quality of life any?
Yes.
I mean, do you
Yes.
worry a lot less knowing that the ceiling's being fixed? And
Yes.
So she has improved the way you feel about getting up in the
If
morning?
I feel down, I call her and she changes things. By just
Oh my
talking
goodness,
to me.
that's wonderful. You know, we really appreciate the way you feel. And would you like to see FAST continue? Do you think
Yes.
FAST should be in every community with fire
Yes.
departments so people know what's going
And
on?
I think they ought to have more than one. I think they ought to give Jamie an assistant.
Is that so she can sit here with you all day?
No, but she's a busy lady.
Yes, she is. Very busy.
For new programs starting up around the country is take it slow. We kind of had this idea or concept and we initiated it as a pilot program, but we probably should have stepped back and maybe thought things out a little bit more rather than hitting the ground running. We might have been able to alleviate some anxieties in the community and with the residents themselves. It's taken a load off of my heart, wanting to be able to go out there and help the people that I serve and help them live safely in their homes. You know, a lot of times we're all getting older, and a lot of times, you know, people want to remain in their homes, and you want to be able to help them out. And sometimes you're able to do that, and sometimes you're not. But the key is to safely remain in their homes for as long as possible.